Good evening, and thanks for joining us on the Indie Practice webinar tonight. We're very fortunate to have a couple of very talented leaders in the healthcare world to join us. Our webinar is sponsored by the Medical Association of Georgia and Indie Practice, which is an initiative from the Medical Association, and VinOps, of which I lead. My name is Mark Maloney. I'm the CEO of VinOps. We're a compliance partner focused on protecting independent medical practices. Tonight we're introducing Practice Beat. It's a comprehensive patient acquisition system with tools usually only available to large health systems in a single inexpensive platform priced for medical practices. The first guest is Rick Cancelero. He is the CEO and founder of Practice Beat. Rick is a visionary and entrepreneur with a passion for helping patients get the health care they need. As an award-winning designer, he brings an aesthetic of design purity and efficiency to his work that delivers results and value to his medical practice clients. Our second guest will be Carrie Lindemann, the CEO of MedCompare USA since 2012. Carrie works with over 650 hospital systems, bringing them Medicare support systems for their physicians and patients. Carrie's passion is helping patients get the Medicare plan they need today. If you want to follow up with us at the end of the webinar, you can either type a question in the chat or you can email me at info@venops.com. That's VENOPS.com. Or I'm sure Rick and Carrie will give you their further follow-up. So without further ado, I'm going to hand the microphone and the screen over to Rick.
All right. Well, I will, once I receive that, I will share my screen here. Let me see. Oh, looks like I got a chance here. Okay. Can everyone see my screen? All right, perfect. So my name is Rick Cancelero. I'm the founder and CEO of a company called TreatSpace, and we started a company called Practice Beat. And I'm here to talk about what blocks patients from finding medical practices. And the reason I want to talk about it is because we help independent practices outperform health systems on Google. Well, what's that mean? Well, what if I told you that there's a giant wall preventing hundreds and thousands of patients from finding your independent practice every month? And that wall was built quite literally to route patients away from you. And Google is the wall. You actually watch them destroy the yellow pages. You no longer use the yellow pages, neither do your patients. They're constantly checking your credibility with fact checkers. They're testing your performance with Chrome. They're assessing your authority in your specialty. And they quite literally built a floodgate to redirect a massive wave of patients away from you. Are they evil? No. Why do they do this? They want to give patients an amazing experience, one that's credible, one that has performance, one that has authority. And they trust practices for three main reasons. They're credible, they perform, and they have authority, right? That credibility, that performance, that authority isn't what you think of when you think of healthcare related. Like, they're not credentialing a provider, right? They're not looking at performance on value-based incentives or outcomes, right? They're not studying where you went to school, right, for authority. They're looking at very technical things. And practices that fail the tests lose the patients. They quite literally block you and go right by you to practices that pass the tests, right? Practices like Atlanta Bariatrics, one of our clients, they score #1 in Bariatrics Doctor Atlanta, Georgia, right? Pain medicine doctor near me, when you're in and around the physician's offices in all throughout Marietta, #1, right? Foundation Psychiatry, #1 organically, right? Practices that pass the tests win the top positions. So what? Why do those top positions matter? right? So I'm just going to give you an example from Myrtle Beach. I was there last month presenting. Primary care doctor near me, that simple search in Myrtle Beach, in just the zip code 29572, the volume of searches is 110,000 searches per month. These keywords, these searches, there's thousands of patients that do not see you if you do not perform. What you see is not what Google sees. What you understand about your practice is not what Google understands, right? They are looking at very different technical lenses, not how pretty your site is. They're looking at how functional it is. They have an algorithm full of different random things like Google Panda, Google Penguin, Spam, Hummingbird, Pigeon, Mobile, Fred. All these different segments of Google's algorithm are literally assessing you. And you could Google Penguin and click on images and see a penguin with a little machete, or Google Panda and you see them with like guns. They're pretty angry pieces of the algorithm, but each piece is assessing your practice in different ways to make sure that you have that credibility and authority and performance. And working with Google is hard, right? There's HIPAA related issues, there's performance, there's page speeds, there's marketing, there's all kinds of different regulations tied to it. There's competition, keeping up with the Joneses. How do you address all these things? Working with us is easy and enlightening because working with Google is so hard, right? The first thing is we are no cost, no obligation to work with us at the front. The first 4 phases of engaging with us are completely free. And the first thing we do is pull your market share. We look at, in your specialty, in your region, how many searches are there per month in the top searches, in the high volume searches. So we look at, is there 300,000 searches per month? Is there 1 million searches per month? What are the core searches within your specialty in terms of eligible traffic? And then we show you what your share is. We do competitor diagnostics, pull your market share, and show you who's outperforming you and what they're doing on a technical standpoint that makes that happen. That performance, that credibility, that authority, the nerdy things Google looks at. And we show you in terms of patient leakage what that's costing you, right? This is all free. We do this for everyone that meets with us. We show you the number of patients searching, we show you the impressions, the clicks, the sessions, and we show you what blockages you have and what leakages you have that are preventing patients from finding and scheduling and requesting appointments with your practice. And then we give you a treatment plan. How do you increase your visibility? How do you cut your bounce rates? How do you increase your conversion rates? What do you need to do with or without us? Again, first 4 phases, no cost, absolutely free. Our goal is to help independent practices outperform health systems. I have a team of 50 people. This is what they do. They live, eat, and breathe this type of work. If you want to work with us, there's options for that. You don't have to. There's no obligation to it. We will show you what we would do to help you and how simple the cost is around that. But first, we diagnose, we prescribe, we offer you a treatment plan, and then if we engage, we do quarterly business reviews with you. We show you every month all of your positions in those searches that we talked about earlier. We track your return on investment. We track your conversion rates. How many appointments were booked? How many phone calls did you get? How many top positions are we scoring? All of that information is tracked. We'll even run diagnostics for all the attendees that are on today's call and pay you $50 if you book today, if you're an independent practice leader taking new patients in a suburban or urban market. Our goal in our partnership with the Medical Association of Georgia and Indie Practice is to help independent practices get their data for free, understand the value of it, what patient leakage looks like, and how to resolve it. Again, there's no cost. You can scan this code or click on connectrick.com, and that'll give you a place to schedule with me. I want to show you quickly how we diagnose patient access. I've got about 3 minutes. Here's a practice that we started working with way before we started working with them. They have a number of orthopedic surgeons. Their online diagnostics showed incredible market opportunity, but they were poor performers in digital, right? We came in, did the assessments, and showed them all the blockage and leakage that was preventing patients from finding them. We use a lot of third-party assessments. In fact, we staff nurses, RNs, a team of RNs staff these calls, attend the calls, and they run over 200 tests and queries to assess your visibility, your performance, your credibility, your authority, your patient leakage, and your competition. We present that data to you. Things like, did you know you're losing 35% of your visitors right in the first 3 seconds to the back button, right? We pull that data, we share that with you. We show you what your patient leakage looks like, right? We did that with Barrington. We walked through the different pieces of the algorithm, what pieces they were failing and why. And we showed them how if they correct those pieces, that weird penguin with a machete, right? That panda with a gun, what they're looking at and how we can fix those elements, or they can fix them themselves, right? And once we fix those elements, they're number one. I dare you to Google orthopedic doctor, Schaumburg, Illinois, right? They're number one in the organic local pack and in the organic search results, right? I pulled up the live results right here, right? We work with single doc practices like Dr. Abelick, who is outperforming Penn Sleep Center on the local pack, and he's outperforming Penn Medicine right here as well on the organic search results. Independent practices, group practices, we love to work with all of them and get them to the top performing positions. We also manage the reputation for these practices, get them thousands of 5-star reviews from their patients so that their online credibility matches their offline. Before working with us, Barrington had declining data on their search console. After working with us, they had incredible upticks in growth, 2,600% ROI just in their first month. We launched a new practice last month, and it was funny because we got a message from them that said, can you turn it off? We've got too many new patients. It was a practice that got 140 new patients in less than a month, and they were really struggling with that. And again, I showed Dr. Abelick, who's now outperforming Penn Medicine in his market. We help independent practices outperform health systems. That's what we do. I would love to run all of your diagnostics for you. I look forward to talking to you. Thank you.
Thanks, Rick. That, as always, is a phenomenal presentation, and hopefully everybody on the call will click and make an appointment and get their $50 presentation. That's a great idea. I'm now going to introduce Carrie Linderman. Let me change the presenter here. And Carrie, I muted you earlier because I was getting a little feedback. So if you'd be kind enough to unmute yourself, you now have the floor. Okay, I unmuted you.
There we go. Thank you very much. As Mark said earlier, my name is Carrie Linderman. I'm the CEO of Medicare Compare USA, and we work nationally with health systems, hospitals, helping them provide guidance to their Medicare patients about the health plans they contract with and accept. As you can see on my short slide deck, you'll see there's a number of health systems we work with today. In Georgia, we're working with both Emory and Northeast Georgia Health System. But we work on a national basis and are growing every year with both hospitals and physician groups. The groups that we work with today, I would say the health systems represent more than 10% of the Medicare population. And we work very hard to ensure that patients have informed information so they can make an educated decision about the health plans their providers contract with and accept. Basically, what I'm trying to do, or what our group is trying to do, is ensure that physicians can spend more time with their patients and hospitals and less time in guiding patients through Medicare options. Because Medicare it's complicated, let's face it. Our value proposition is that we provide services to both patients, staff, volunteers in the community. Our service is not bound by just talking with patients, but in essence, what we're trying to do is simplify the Medicare environment and making sure that people understand what their insurance options are. It's particularly complicated for patients that are aging into Medicare. So those that are approaching Medicare eligibility, they're both facing a myriad of options with health plans approaching them on a regular basis, promoting their numerous products in the marketplace. It's a lot. So patients often ask their doctors for assistance. And what we can do is help the practices by helping those patients understand the plans accepted by the practice, help them understand what options make the most sense for them. Ultimately, it's the patient's buying decision. It's up to them which plan makes the most sense for them, but we give them the tools to make informed buying decisions. We also work with groups to help them educate their patients about the importance of the Medicare annual well visit and also the usage of the electronic medical record systems. So depending upon your initiatives, we can help your patients increase your annual well visit encounters, as well as if you're trying to get your patients to engage in your EMR system so that they can engage with you electronically more readily. Our services are CMS compliant. Everything we do around patient communications when we're working with our clients is designing those communications that break down and explain the Medicare options available to those patients and the various ways in which your patients can connect with us. What we're trying to do is eliminate or reduce the staff burden and the compliance exposure, because there are very stringent rules around what providers can and can't say to their Medicare patients about the health plans they contract with and accept. The benefit to your patients is that we are an unbiased resource to compare and enroll in Medigap, which is Medicare Supplement, Medicare Advantage, as well as standalone prescription drug plans. We represent the plans that you contract with and accept. You let us know which plans are your preferred plans or those that you contract with, and we walk your patients through those plans. They're all different, and your patients' needs are different, so there's no one plan that fits everyone. We provide Medicare educational resources from online, a Medicare on-demand platform. We hold Medicare 101 seminars, as well as our services provide a video option that your patients can download or watch on demand. We provide assistance each year. You know, we're walking into, or we're fast approaching, I should say, the annual enrollment period. It starts in October. And that's a time of year your patients that have Medicare Advantage or standalone prescription drug plans can change plans for the following calendar year. Those plans can change or are required to refile their benefits every year with CMS. And so what you'll see is that your patients are exposed to changes with their cost sharing amounts, their maximum out of pockets. There's changes in formularies. And so it's prudent for your patients to look at what plan do they have today and is it still meeting their needs, providing the best coverage for them at the lowest out-of-pocket cost. We can help your patients understand if they have the best product that's available in the marketplace for the following calendar year. Our services are free. There's no obligation for your patients. So when they call us, whether they call us once or they call us 10 times, each time that they speak with us, we're going to provide them unbiased guidance and try to help them make an informed buying decision. Again, we also represent those plans that you contract with and accept. What we're trying to do is protect the continuity of care. There's so many, the marketplace is fairly noisy. There are retailers like CVS, Costco, Walgreens, now Amazon. They're all vying for your patient's attention, and they're representing or contracting with Medicare Advantage plans. What we try to do is try to block that noise and make sure that your patients are ignoring these other suitors that are trying to convince them to enroll in plans that suit their financial objectives. Our objective is to make sure that they're looking at plans that you contract with and accept, representing your interests. What we've rolled out recently is an online CMS compliant Medicare platform. It's called Medicare On Demand. What we've provided is a landing page, if you will, for your patients to visit Medicare resources at their convenience. If they want to talk to a telesales agent, there's a dedicated phone number they can call and talk to someone and ask the questions of any sort of question about Medicare, and we're happy to help them. But we also have the ability to support them if they'd like to meet with a local agent. We have lots of agents here in Georgia that would be happy to sit down and talk with them about their individual needs and the plans that you contract with and accept. This platform also offers an education center. It's basically a library from A to Z that allows your patients to surf and learn about or answer the questions that they have, whether it's understanding what's the difference between Medicare Advantage or Medicare supplement plans, what is Part A, what is Part B. It's a library, a whole host of information available at their fingertips. And then also we have a plan comparison and enrollment tool, which essentially is an application that your patients can put in their zip code. They can put in their doctors, their care team, medications, and their preferred pharmacy, and they have a tailored experience, shopping experience in the convenience of their home. It gives them a sense of what products are available that their providers accept, what their projected out-of-pocket costs are. It's a tool in which it gives them a sense of information or plans that are available that you contract with and accept, both from a Medicare Advantage standpoint, but it also represents Medicare supplement plans and prescription drug plans. So the platform exists, if you will, to ensure that patients have access to information that's reliable and at their fingertips. This is a product that we are rolling out. The health systems, Emory and Northeast Georgia, both offer this platform to their patients today. And I look forward to bringing the Medicare On Demand platform to the state of Georgia and to your practices. That's about it, Mark. I welcome questions if anyone in the audience has questions at this point.
Well, thanks a lot, Carrie. If you have any questions in the audience, please put them in the chat. And let's see here. Here we go. Let's see if we have any questions in the chat. We have one from earlier. Rick, are you still with us?
I am.
Okay, so what is the difference between Practice Beat and, say, the practice's current SEO agent?
And the what?
What is the difference between Practice Beat and maybe the search engine optimization program they currently might be using?
Oh, sure. Search engine optimization is kind of it's a no-win game if you're doing it in a vacuum and you're doing it in servers that are not on Google Health servers. You want to make sure that whoever you're working with is in a direct partnership with Google Cloud and Google Health. And you also want to make sure that the algorithm that is updated almost daily is being updated based on algorithm best practices and changes that occur daily. And so if you're just managing what I would call search engine optimization, there's backlinks that you need to look at off page, on page. There's all kinds of different tools that you need to look at on making sure that your ADA compliance is up to speed. Your site is managed from a performance standpoint, that it's following the best practices, it's secure, and it's HIPAA compliant because Google's checking that. There's a lot of different components to it. And so in healthcare, it's very different. And part of the problem is too, a lot of designers that are not in healthcare don't even know how to encode a practice in schema as a medical practice. And so there's a lot to it. And most generalists have no idea what they're doing when it comes to medical practices. We've learned that firsthand. We have another business with thousands of customers in it where we had to build Practice Beat as a result of the failures in terms of getting referral management completed for our referralmanagement.com customers. So TreatSpace owns referralmanagement.com. We built a whole system around referral management where we actually won $1 million for saving lives in our system. Solving patient access was a big piece of that, and Practice Beat was one of the tools that we needed to put in our quiver to make that happen.
Okay, well, very comprehensive answer. Very good. And Carrie, it sounded to me like you talked about so many different tools that you could make available to the practice, from a landing page to information cards to telephone opportunities to shop and resources. And I also heard basically that one of the biggest benefits is that you retain patients within their practice so that when they sign up for a plan, they don't wind up with the practice or the healthcare system across town. And the thing that I really heard, and you might want to amplify on this, is that it's free.
Yes. Yeah, absolutely. We can
How do
help you to your
do that?
patients. How do we do that? Well, we are our compensation model is we're compensated by the health plans. When we
Okay.
do a good job for your patients, they compensate my agents for helping them select the right health insurance. And we're motivated to make sure that those patients have the right plan, because if they don't, they're going to let you, the practice, know that you referred them to someone that has put them in a plan that now they can't see their doctor or their meds are unaffordable. So we're motivated to make sure that the patient has the right plan at the right time, and recognize that the senior population, or those that are over 65, their conditions change over time. So we check in with them on a regular basis to make sure the health plan is working for them. They understand the benefits that they have. We review with them during the annual enrollment period to make sure if anything has changed, whether or not there isn't another plan that might better suit their needs going into the next calendar year. Because also the health plans are changing. So we do our best to make sure that people have access to information, however they choose to connect, either through this Medicare On Demand platform or calling a dedicated helpline. But we want to make sure that people understand what their options are and protect that continuity of care. So as you say, they're not showing up across town at another practice's office. But
That's
yeah,
great.
compensated by the plans, and happy to help reach out to the patients on behalf of the physicians.
Well, I heard the free word, that's for sure. And what's your email if they want to follow up with you?
So my email is Kerri, Kerri, .lenderman, Lenderman, at mcusaconsulting.com. A bit of a long one. My apologies.
That's okay. If they remember info@venoff.com, I'll pass them on to you. And Rick, thanks again for your time. As always, a phenomenal presentation. Carrie, thank you very much for your time. And I wish everybody a good one.
Thank you so much. Thank you for the opportunity.
Thank you. Thank you, Carrie.
Thanks, Rick.